Story 1. If you or your mother have already been through menopause but your period comes back even once, insist on testing. Postmenopausal uterine bleeding is uterine cancer until proven otherwise. Story 2. Itchy hands and feet. My mother had a tumor in her pancreas, and this was the symptom her general practitioner, a fantastic doctor, took as a sign for further testing. I do not think she would be here now if it were not for him taking it seriously. The itchy hands and feet were caused by a buildup of bilirubin in her bile ducts, caused by the tumor in her pancreas. She underwent a Whipple procedure and they found the cancer early. There was no further treatment, and it has been 11 years with a full recovery. Story 3. Sudden, unexplained breathlessness that takes some time to recover from, followed by a return to normal, is a major sign of pulmonary blood clots. I saved a friend with this knowledge. I had been treated for an illness that caused the rare adverse reaction of pulmonary embolism. I asked my primary care provider what to watch for so I wouldn't become overly anxious. She told me sudden breathlessness means go to the hospital immediately. Now back to my friend. She broke her foot and was immobile. A few of us visited to help, and she mentioned feeling unusually winded earlier that day. I casually said, "Sounds like a blood clot," and my friends called me a hypochondriac. About an hour later, my friend with the broken foot said, "Yes, I need to go to the hospital. Google says it could be a blood clot too." She went to the hospital and was found to have 2 massive blood clots. She was very lucky to have caught it in time. Story 4. My father recently died of acute myeloid leukemia. Keep in mind, he vehemently refused checkups or doctor visits for any reason. Seemingly innocuous symptoms clustered together can be a sign of a much bigger issue, as I have learned. From my memory, he slept excessively, experiencing fatigue. He had frequent colds for which he kept taking over-the-counter medicine. He had weakness that we did not notice. Close to the end, he had stomach issues for many days, which I discovered by chance. The sudden alarming weight loss was the last straw. It forced him to go to the hospital, and he died in less than a week. Separately, all those issues are usually nothing serious, but in this instance, they were a huge warning sign that he chose to ignore. Story 5. It might not necessarily be a symptom that requires a second opinion, but it is something that deserves attention. When someone is very depressed and suddenly appears more cheerful, starts making plans with friends and family, gives away their belongings, and even seems somewhat relieved, this can be a sign of suicidal thoughts, where the person may have already chosen a date to end their life. Also, something many people do not realize: using tetrahydrocannabinol, also known as cannabis, can trigger severe psychotic symptoms. Often, people start using more to try to suppress feelings like paranoia or anxiety, but this actually worsens the psychosis. The same goes for nitrous oxide, commonly known as laughing gas. Story 6. I just lost my mother a few weeks ago from a massive brain bleed. She was 70 and had been generally weak for a few days. Then she started experiencing brain fog. As soon as that symptom appeared, I helped my father take her to the emergency room. We thought she was having a stroke. She was quickly taken for a magnetic resonance imaging scan, which showed no sign of a stroke or any bleeding. She was admitted to the progressive care unit with elevated calcium levels, with a plan to discharge her in 48 hours after normalizing. No more than 12 hours after her magnetic resonance imaging scan, she had a massive brain bleed in the progressive care unit. She was effectively brain dead immediately. I have wrestled with whether anything could have been done many times since. Multiple neurologists have told me no, the magnetic resonance imaging scan would have shown if there was any bleeding, and when she did experience the bleed, she was in the only possible place, a hospital, where anything could have been done. There were signs, but at the same time, it just happened. I am sharing this partly as I continue to process the trauma of her loss, and partly to say that you can have symptoms, go to an emergency room and get tested, but even then, death is undefeated. Story 7. Being more tired than usual. People tend to think they are just getting older, maybe overworked or stressed, but it could be an easily fixed issue like a vitamin deficiency. Could also be something serious but treatable, such as hypothyroidism or other urgent conditions that need attention, including sleep apnea and heart disease. Story 8. My obstetrician gynecologist once noted that my thyroid seemed slightly enlarged but dismissed it once my blood tests came back normal. It was cancer, discovered later. Thankfully, it was a slow-growing and easily treatable type, but it is still important to follow up on anything that seems even slightly unusual. Story 9. Frequent pins and needles in your extremities. For me, it is my hands and wrists, and it is a symptom of a vitamin B12 deficiency. Unfortunately, this means that the deficiency has been present for several years, as it is a neurological symptom which is very serious. Other symptoms include fatigue and brain fog. These symptoms, for me, were concurrent with the onset of menopause, which also includes fatigue and brain fog, anemia due to low ferritin that had been treated, and a vitamin D deficiency that was also being treated. This made it very difficult to identify the cause, and I had to insist on getting a blood test. My doctor initially dismissed my symptoms as classic depression and anxiety, but I recognized the markers of my long-term depression, and they had not returned. Pernicious anemia, which causes a vitamin B12 deficiency, is very common in older women and is often diagnosed very late, years after symptoms first appear, because the symptoms are easily dismissed by both patients and doctors. In my case, it is not pernicious anemia but a vitamin B12 deficiency caused as a side effect of taking metformin for a long time. Metformin prevents dietary absorption of vitamin B12, as I understand it. This side effect is fairly common and can affect around 1/3 of patients who take metformin long-term. I am taking metformin to treat insulin resistance linked to my polycystic ovary syndrome. Story 10. A wart that just keeps coming back after treatment. Eventually, they took a biopsy, and suddenly it went from, "Oh, this is annoying," to, "I might die in 3 months," for my father. It was Merkel cell carcinoma, and luckily they only had to remove part of a limb rather than his whole life. Story 11. Night pain in hips or back, or really any bone, especially pain that wakes you up at night in children. This symptom will prompt an MRI more quickly in pediatric orthopedics. Story 12. Doctors told my mother she just had arthritis when she kept complaining of back pain. She had a large tumor on her spine and died less than 2 months after it was finally found. Always get multiple opinions. Story 13. I thought I had random heartburn that only occurred when I walked upstairs. There was no chest pain, just a tight belt feeling and a slight jaw ache. I went to urgent care, and troponin levels were positive. It was a heart attack. If indigestion appears with exertion or comes with jaw or arm discomfort, get checked promptly. Story 14. A mild symptom such as persistent fatigue or unexplained weight loss could warrant a second opinion to rule out a serious condition. Always trust your instincts if something feels wrong. Story 15. I do not know about mild cases, but not removing your gallbladder when necessary can result in your pancreas becoming infected and dying. Story 16. Fast breathing and sudden cognitive decline can indicate ongoing sepsis. These are part of the quick sequential organ failure assessment used by doctors and nurses in diagnosis. If your systolic blood pressure is under 100, you need medical attention as soon as possible. Story 17. Tooth infection can lead to a heart attack. I am not a doctor, but it happened to a friend who nearly died. Story 18. Chest, neck, back, arm and finger pain along with tingling or numbness in the arm and fingers. If symptoms worsen when you lift your arms over your head, you may have thoracic outlet syndrome, which can take doctors years to recognize. My symptoms started with left-sided chest pain, followed by arm pain and numbness in my fingers. It progressed to random episodes where the entire left arm felt weak and detached from my body. I thought I was going crazy because it felt like the pain was moving around in my chest, back, and arm and fingers. Thoracic outlet syndrome is the compression of nerves, veins, and arteries. Can affect 1, 2, or all 3. Discoloration in the hands is a sign it is vein or artery related. Story 19. Recurring low iron and/or vitamin D, a brain fog type feeling, foul-smelling flatulence, or painful bloating. For me, it turned out to be celiac disease. Story 20. Taste alteration. Foods and smells that taste different or unpleasant without chemotherapy or pregnancy can be concerning. Any taste alteration accompanied by weight loss is a serious red flag. Some of the most challenging cases have been those who can no longer tolerate the taste of meat or the taste and smell of fats. such as bacon cooking. I may have the bias of working in a quaternary care center with many cancer patients, but taste alteration plus even one other symptom concerning for malignancy prompts me to scan the abdomen for pancreatic cancer. Story 21. Sudden loss of balance was my dad's only symptom of a stroke. Luckily, he recovered, but he needed a cardiac catheterization and was found to have heart failure as well. Story 22. If you are always tired even with good sleep and a normal routine, do not brush it off. It could be early signs of conditions such as anemia, thyroid issues, or autoimmune disorders, and even serious diseases like leukemia or lymphoma. It is easy to ignore, but it is better to check early. Story 23. Pulsatile tinnitus is hearing a dull thudding or whooshing sound in your ear that matches your heartbeat. It is normal to hear your heart pounding in your ears immediately after strenuous exertion, but if you can hear your heartbeat in one or both ears at rest, that is concerning. What you are hearing may be a bruit, a sound caused by turbulent blood flow. Something may be compressing one of your arteries, such as a swollen lymph node or a tumor, or something has changed the shape of a blood vessel. Whatever the cause, it warrants immediate investigation. I had a bulbous dissection of my left internal carotid artery, and pulsatile tinnitus was the only symptom. Story 24. Sharp pain in the sternum shortly after drinking even a small amount of alcohol. I thought it was just kind of weird. It was dismissed by the general practitioner twice as probably just a strain or injury. Finally, the third general practitioner sent me for an ultrasound, which suddenly turned into a series of more serious tests. It turned out to be an obscure but known symptom of Hodgkin's lymphoma. It was stage 4 by that point, but chemotherapy worked, and here I am 16 years later. Story 25. Increase in floaters in your vision. My husband had more than normal show up and went to the eye doctor that day because an appointment opened up. He went straight from the doctor to surgery for a detached retina. Take care of your eyes. Story 26. Fatigue, joint pain, bone pain, brain fog, upset stomach, frequent urination, kidney stones, depression, and insomnia, any one or combination of these plus high calcium could indicate hyperparathyroidism. There are other symptoms too, but high calcium is the main indication. I am perimenopausal and have always had insomnia. I assumed my symptoms were due to perimenopause. Since having one enlarged parathyroid removed, my joints have improved, my sleep is better, I have less fatigue, and less upset stomach. Overall, I feel much better. Do not let your doctor dismiss high calcium. Story 27. I went to the doctor multiple times over a 6-month period with on and off stomach pains, very intense pains. I changed my diet, avoided stress, and did everything I was told to do, but nothing changed. I was repeatedly told I had gastritis and was given medication for that. Eventually, my gallbladder ruptured. I spent a week in the hospital with damage to my pancreas, liver, stomach, and bladder. I underwent surgery to remove what was left of my gallbladder, and my stomach pains went away. I questioned why they never checked for gallstones, and apparently I seemed too young, so they did not, despite my many symptoms. Story 28. I would also consider fatigue, weight loss, insomnia, headache, and other symptoms that are very common in anxiety or depression. Many patients, as a mental health physician, come to me after extensive investigation for these kinds of symptoms. They visit many different specialists, spending thousands of dollars and a lot of time trying to figure out what they have. Then the symptoms basically disappear after starting medication and therapy. So yes, it might be cancer, but in most cases, it is generalized anxiety disorder. Story 29. Suddenly experiencing shortness of breath while slowly climbing a flight of stairs in a young person. Observed some abnormal heart tracings. Someone sweating profusely in a cold room always makes me uneasy. Story 30. Fingernails do not grow past the nub because they break off too easily, and hair thins at the same time. I thought it was just due to aging. I am 64, but it turned out I had a 100% blockage of my left anterior descending artery, also known as the widowmaker heart artery. I believe that when circulation is poor, the body decreases blood flow to non-essential areas such as hair and nails. I was also experiencing chest pain and shortness of breath after walking half a block or climbing one flight of stairs, but I thought it was from long COVID. After undergoing angioplasty and receiving 3 stents, my stamina returned, My nails started growing again, and my hair became full again. Story 31. Ladies, please schedule your annual Papa Nicolau test and mammograms. This is the best way to detect any issues early in the breast and gynecological areas. Story 32. If you regularly experience déjà vu, especially as part of anxiety or panic, with a rising feeling in your stomach like you are on a roller coaster, these can be signs of temporal lobe epilepsy, which is often missed and misdiagnosed. Story 33. Ptosis, or droopy eyelid, can be a sign of a rare autoimmune disorder called myasthenia gravis. Many patients begin with eye symptoms before progressing to generalized muscle fatigue that affects their ability to walk, talk, chew, and breathe. Story 34. Back pain. My dad kept going to his doctor about his back hurting and was told to just take Robaxacet. He developed jaundice, went to the emergency room, and stayed for 3 days undergoing tests. Turned out to be cancer. Less than 6 months later, he died. Story 35. Unexpected or unexplained weight loss. Both my dad and grandpa died of cancer. They both, especially my grandpa, lost a lot of sudden, unexplained weight. My dad had a very rare and aggressive biliary cancer. The bile ducts connect the pancreas, gallbladder, and liver, ascending through the liver. This cancer is as serious as liver and pancreatic cancer. His main symptoms were severe itching and jaundice because bile leaked into his bloodstream due to the cancer blocking the bile ducts and invading his liver. These symptoms indicated he was only days away from death. Story 36. A drifting or lazy eye in a baby or child under 5 years old can be a symptom of bilateral retinoblastoma, which are cancerous tumors in the eye. My son, who is 15 months old, had this as his only symptom. He has just completed his 3rd round of chemotherapy. Story 37. Dry cough, even if not frequent. Could be nothing, or it could be lung cancer or an interstitial lung disease, some of which are as deadly as cancer. Story 38. Bloody bowel movements, even if you have just one every few months. Please see a colorectal surgeon or gastroenterologist, especially if you are anemic on your annual lab tests. Story 39. When the soft palate becomes asymmetrical. How to see it? Stand in front of a mirror. Look inside your mouth. The back should be symmetric. If it is asymmetric, there is likely something growing in the soft tissue of your neck. Story 40. Chest pain that radiates to your back. I had just recovered from chickenpox and had returned to school at 15 years old. During class, I started feeling a strange chest pain that seemed to radiate to my back from time to time. I went to see the nurse, and about 2 hours later, I was diagnosed with myocarditis caused by the chickenpox virus. It is believed that this myocarditis also led to other heart conditions such as bradycardia, sick sinus syndrome, and dilated cardiomyopathy, for which I now have a pacemaker. Story 41. Spots or floaters in the eyes. A sudden increase in floaters could indicate a retinal tear. Story 42. Increased urination in females. I had never gotten up in the middle of the night to urinate, but suddenly I was waking up every night to use the bathroom. I had an ovarian tumor the size of a grapefruit resting on my bladder. Story 43. Pain during sex. I started to feel a brief dull ache on one side of my pelvis at orgasm. Since it was making sex much less enjoyable, I had it checked. It was a potentially precancerous ovarian tumor. The tumor was removed without further incident. The pain disappeared. Story 44. My father was like that. Fatigue, aches and pains, weakness. He put it down to being in his 70s, saying, "I'm just getting old." Until my mother and I urged him enough times that he finally made an appointment with our family doctor. Our doctor took one look at him and asked, "Ed, how long have you had that lump on your neck?" Dad asked, "What lump?" Somehow, Dad had been ignoring symptoms of stage 3 Hodgkin lymphoma. He was successfully treated with chemotherapy and lived another 7 or 8 years free of that disease before dying of an unrelated illness at age 84. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.